Hi, welcome to the April installment of our virtual C-Dub Classics presented by Kaiser Permanente. C-Dub Classics provides monthly health and wellness activities to Santa Cruz County residents. I'm Dr. James Vager, and this is my colleague who works here at Precision Physical Therapy, Dr. Matt Davis. We're both physical therapists at Precision Physical Therapy and Fitness, and that's a locally owned physical therapy center in Santa Cruz. We have 3 locations, one in Aptos, one in Mid-County Santa Cruz, and the one that we're in right now is at our Scotts Valley location. I have 26 years experience as a physical therapist, and Matt, what about you?
A few years, just 3 years, but I grew up here in Felton, so close by, and I actually started as a volunteer for you guys before I went to physical therapy school.
Yep. So Matt has a lot of experience with the types of things that we do here at Precision. We do physical therapy a little bit differently than the traditional model of physical therapy. We are focused on finding out how your particular body functions and what's not working well so we can correct the problem that you're having that's specific to you. And with that in mind, we're today going to be talking to you about back pain. Back pain is the biggest reason people go see their doctor. It's the biggest reason people come to get physical therapy care. And so we wanted to give you a few things that you can do, a different awareness about your posture, and a couple of activities that you can do to help keep your back in shape so you can avoid coming to the physical therapist. But if these things don't work for you, then we definitely recommend you get that care that you need if your pain doesn't respond to these activities. Or if you're curious about getting more specific help to your specific problems, then come in and see us. Also to remember, the things that we're going to be showing you today are meant for the general population, for everybody that might have a back problem. And we know through experience that how you move your body and what you use your body for is very specific to you, and your problem may need specific individualized attention. So with that in mind, let's start talking about back pain.
The first thing I want to talk about is how sitting can affect your low back pain. With our society today, we're sitting all day at the desk when we're kids growing up in school, and now we're sitting at our desk jobs, or we're sitting more because of the quarantine. So what we want to work on is where someone is in their chair. The first thing I would say is trying to bring your hips all the way back to the back seat and the low back against the back chair. The reason for this is to let the low back rest and without having a slouched position. So if you're up further in the chair, right, there's 2 things that are going to happen. He's either going to be overusing his muscles in an arched position, or he's going to be slouching where the back of the low back is going to be rounded too much, and those structures are not going to be, so all the muscles in the back are going to be too long. So if he brings the hips all the way back, and he sits, there you go, and then let that low back sit against that backrest. His hip is at a 90-degree angle, so he has good hip flexion there, and his back is stacked just like that. A couple other things to add about the sitting posture. So the hips all the way back, he's at a 90-degree angle there, and then you want to have your feet flat on to the floor. So here you can see that there's kind of a 90-degree angle right there, okay? And his feet are on the floor. Now some people might be tucking their feet underneath, which can affect your low back, or they might cross their legs, which can affect their low back as well. So we recommend, if you can, getting the feet flat on the floor. So if you need a step to do that, then you can get a small step if you feel like your legs can't reach. But in general, you want those feet flat on the floor just like that. Now, if you don't have access to a step, I would recommend putting your feet on the ground. So if you have to do that without sitting all the way back, we recommend putting the feet on the ground because that's the most important. That way it supports your body and you don't have to overwork your low back.
Okay, so now we're going to talk about standing posture, which is the posture that we are most vulnerable in because it takes into account a lot more joints. So when we're sitting, we're basically sitting on our butt, and our knees and our feet are not really as involved. But in standing, we have to take into account what our feet are doing, what our ankle is doing, what our knee is doing, and that's going to affect what our hip and then our low back does as well. So these are some basic rules about standing posture. Standing posture can be a very difficult thing to correct because it's really hard to monitor yourself like in a mirror and look at yourself in the side without changing how you're actually standing. And it's something we do so unconsciously that even when we're doing it poorly, we're not really aware of what's happening. But we have an activity that we'll show you in a bit about how to correct that standing posture and make sure that you're standing straight. So in general, we want to make sure that your weight is evenly distributed between the front and the back of your foot. Many times people will come in with their weight shifted very far forward and their shoulders way back here. Or another option that we see, another thing that we see people do is we have their weight really far behind them with an extra arch in their low back. And we know that once you set up your standing posture correctly from your feet, that it gives you much more likelihood of success farther up the chain. So make sure you have weight even between the front and the back of your foot. And that should even out the position of your tibia, which is the lower part of your shin right here, this lower part of your leg. So starting from the foot, we want to make sure that the next part, which is your tibia, is vertical, meaning it's not too far back and it's not forward, that it's perpendicular to the ground. After that's lined up, we want to make sure that the femur or the thigh bone is vertical on top of that tibia. And that's probably the trickiest part for people to get, and that you may need a little extra help. So for Matt, I just want to bring him back just a little bit like this. And then we want to make sure the shoulder is on top of the hip once we achieve that position. And so we're just looking for that vertical alignment. Ideally, the ear, the shoulder, the hip, the knee, and the ankle will all be in a straight line. So this exercise that we're going to show you is all about learning how to achieve that upright posture. And the good news is we all have a wall in our house, and this is a really good way for us to teach our bodies how to recognize straight up and down. So to start this activity, I want to have Matt back all the way up to the wall so his heels touch the wall. The next thing he's going to do is just bring his butt to the wall just a little bit. And then from there, he's going to bow forward just a small amount, letting his butt slide up the wall. Then he's going to stop, keeping his butt right where it is. He's going to lift his upper body to the wall. So the back of his shoulders right along the shoulder line and the back of his head should be able to touch that wall. Not everyone can do it right away. That's something you may need to work toward. But this is a really good way to teach your body that vertical sense, what up and down really is. This will train your muscles to work in the way they're supposed to. This will give your brain, your internal brain, the sense of what your body is doing and how it needs to be vertical and where vertical is. So I'd recommend that you do this for a few minutes at a time. This is about practicing. This is about making it easier. It's not about doing a certain number of reps or for a certain amount of minutes, but doing it so you can feel your body change. That's what's most important. Everybody's body is going to respond a little bit differently, and some people can do this for a short time and get a benefit from it and learn it and know it really well, and some people need more practice. It's all about you and how your body responds.
All right, so one of the exercises that we most often give our low back patients is called seated knee extension. So what I'm going to do is talk about how that applies to the sitting posture. So let's take James here. He's sitting in a little bit of a slouched position, right? So if he's been sitting all day like this, his low back muscles are getting long and his hamstrings might be getting short there. So when I do a test to see if this is an issue, I'm going to have him sit up as tall as he can. And then I'll say, can you straighten your knee for me, please? And as he straightens his knee, I can tell his low back is rounding over here. And that's because his hamstring has been stiffer than his low back. So what that means is that as he's going out, his hamstring is actually pulling his low back into that rounded position. So what I'll have him do is we're gonna go back up into this erect kind of arched low back. And I'm gonna say, keep it like here, keep this arch as you straighten your knee, and I want you to stop before you start rounding, which might be right there, and you can feel probably a pull on his hamstring, or you might feel his quads working, and then come back down, and let's go ahead and do it again. Now, if you can't feel that here, you might need someone to make sure that you're staying in that upright posture. A lot of times people are doing it, and they're going into that rounded position too much, so you gotta really keep the arch there. And each exercise is specific to every individual, so if you need any extra help, make sure that you go reach out to your physical therapist. Another tip for this exercise is you could use your hands all the way in the low back and keep that arch. That way you know if your back is rounding by the pressure on your hands.
Thank you on behalf of the Santa Cruz Warriors and Kaiser Permanente for joining our C-Dub Classics back pain class today. We have activities the last Monday of every month. For more information, visit santacruzbasketball.com/classics. If you want to find out more information about Precision Physical Therapy and Fitness, you can find us online at www.prefitpt.com.